Hello, my name is Carolina Paranto, and this is my presentation on healthcare in Hispanic Americans. I am a LPN in the LPN to BSN program at Indiana State University. The learning objectives for this video are at the conclusion of this presentation, the viewer will be able to classify a population at risk and how Hispanic Americans fit into this category. At the end of the video, the viewer will be able to explain how holistic assessments are important in Hispanic populations. At the conclusion of this presentation, the viewer will be able to identify how beliefs impact care in diverse client groups, such as Hispanic Americans. And at the conclusion of this presentation, the viewer will be able to explain the hot and cold theory. At this time, if you would like to pause the video and take a look at the pretest and complete it, as well as the accompanying handout, please pause the video and start the video once you are done. A population at risk is a population that is at risk for poor health outcomes and for chronic illnesses. Hispanic Americans do make up a population at risk. According to the U.S. Department of Health and Human Services Office of Minority Health, 51% of Hispanic Americans are uninsured. That makes them the largest uninsured rate of any ethnic group in America. By comparison, 34.6% of non-Hispanic Caucasians are uninsured. This shows a large health disparity. Such a high uninsured rate also puts Hispanic Americans at risk for health issues because they are not following up with providers due to lack of access. They also have language barriers. 29.8% of Hispanics are noted to not be fluent in English when surveyed. That makes it hard for them to understand their healthcare providers if they are not Spanish speaking. It makes it hard for follow-up in healthcare, and it just makes it hard for follow-up treatment for chronic health issues in general. In 2017, the U.S. Census noted Hispanic Americans make up 18.1% of the total U.S. population. That makes them a large population in the United States, which further shows how detrimental that 51% of uninsurance is. Healthcare practices. It's important in nursing to complete a complete holistic assessment, taking into account a patient's physical exam, social, psychological, developmental, spiritual, and cultural aspects. In a Hispanic patient, family is very important in making healthcare decisions. That is why a nurse needs to know and include the family for health compliance, because the family is going to be helping the patient as well as making healthcare decisions with the patient. Hispanic Americans use a lot of teas and herbs to treat medical conditions. It's important to note this as well and to take that into account when doing an assessment and when looking at the medication list. Two important herbs to take into account are azarkan and greta. These are used in stomach issues like diarrhea and vomiting, and are known to lead to lead poisoning. It is detrimental for a nurse to know about cultural aspects of patients, to know which teas and herbs to look out for and which ones to add into a medication list for the physician to be aware of. Verbal communication is very important in Hispanic communities. Communicating verbally and being open with the patients and the families is important. Hispanic Americans also tend to be present-oriented. They may not screen for illnesses until symptoms arise. It's very important to know this as a cultural aspect for the patient so that you are aware and you can educate the patient and the family on making sure to screen for illnesses and follow up with a healthcare provider before symptoms arise, and to make sure to follow up with appointments if there is a chronic health issue, as well as helping to have the family members also complete that. What are some important notes to keep in mind when completing a holistic exam with a Hispanic patient? First, it's important to know that family traditions vary, as well as cultural traditions. They vary from family and patient to patient. These are very broad notes to keep in mind. When completing a physiological exam on a patient, Hispanic patients are higher at risk for diabetes, cardiovascular diseases, lactase deficiency, and pesticide poisoning. It's important to follow up with the patient and ask questions regarding these symptoms to see if they are having any diabetes episodes, if they're having symptoms of high blood sugar, or any issues with their heart, or any DVTs, anything like that. Psychological exams and sociological exams are important, checking to see if the patient has any high stress levels. Also important to keep in mind how important family is and keeping the family included in the conversation. Developmental, how are they developing? How is their stress level? Spiritual, Hispanic families tend to be Catholic, and those Catholic beliefs vary very much based on the family. And cultural, their diet is high in sugar, coconut oil, and animal fats. This is also important to remember and ask and speak to the family. Educate the family on a low sugar, low fat diet and the benefits of eating healthier diets. An important theory to be aware of is the hot and cold theory when talking to a Hispanic patient. In a hot and cold theory illnesses are caused by a disruption in the hot and cold balance of the body. A lot of these vary by family, but in general, hot conditions are generally infections, diarrhea, and sore throat. They are cured with fruits, vegetables, and dairy products. Cold conditions are generally cancers, malaria, and earaches. They are cured with liquor, beef, pork, and spicy foods. It's important to remember this when having a patient in the hospital, because if they have an infection, it's important to know these hot and cold remedies and gear their dietary choices towards the healthier versions of these foods, while also being culturally sensitive in offering them these foods, so that they're not offended when giving them vegetables when they're in the hospital for malaria. How do belief systems impact care? They impact care in a Hispanic patient because it's important to include their family. The family is very important in making healthcare decisions, and they keep the patient compliant. Consider the patient's diet. Consider their culture, things like the hot-cold theory. Consider their spirituality and consider their working conditions. These are all very important things to keep in mind when assessing the patient. If at this time you could please pause the video, complete the post-test, as well as take a look at the handout if you have not already done so. Here are the answers to the test. Here are the references used in this slide. If you would like to take a look at any further information, there is some websites here as well as on the handout. And thank you very much for watching. Have a good day.